Now going into the topic of contraception, doctor. So the first, I want to ask you from your experience, the patients who come, what are the prevalently used contraception among the patients that you've?
In Kerala, the most common things are before first marriage, many people are resorting to condoms or barrier methods. Some of them will use pills before first pregnancy. After first pregnancy, the most common one is copper T or intrauterine devices. Because the health workers or the government health staff, they will go around and they will canvass couples and they will ask them, you put this copper T inside and next 3 years or 5 years you need not bother about next pregnancy. Go and enjoy your life. You are already having one kid. You take care of that child till he or she goes to school. Then you will think about your next pregnancy. So many people fall into that temptation of getting the second pregnancy delayed for 3 to 5 years, and they say copper T is the best option. So copper T is there, and some couples where the husband is working abroad or not together, some of them will resort to this oral contraceptive pills. So they will be coming for 2 months. So they will take this pill for 2 months, and once he is gone, that is over. So some of them are using like that. But some people will use copper T, that is common over here. Some people will be using barriers, that is also very common. Oral contraceptive pills use is actually not like how it is in European countries, but is actually less. And the other one is sterilization. Once they get 2 or 3 kids, they will go and destroy their fertility. Sterilization. So these are the common methods of contraception over here. That is.
So this can be extrapolated to India as a whole, right? Or it depends on state to state?
I don't know, because I haven't gone to outside states too much. I have experience from this part of this country, because I have been only in South India and I haven't gone much towards the northern states, because I think in northern states the influence of contraception is relatively lesser, because they are having more kids and all those things. But in southern states, this first delivery and the common people, they may not be using condoms or anything. So the health workers will come and tell you, put a copper T. So they will put this copper T, and after 3 years or 5 years, they will remove it. Some will conceive, some may not conceive after this copper T, because I'll go to the problems associated with the contraception later. So after second delivery, they will go and do the sterilization, and that is over. Even whether their children die or not, the health workers are not worried, and that is over. So the sterilization, the number of people who are sterilized in Kerala, the eligible couples means between the fertile age group couples, it is more than 60%.
Wow.
More than 60% of the eligible couples are sterilized. So if some calamity happens, like how it happened in a few years back, the tsunami, or last year something called a tornado, Oki, it happened in Trivandrum. Something has happened. It's terrible, because maybe their life partner is no more or something. These girls have already sterilized or destroyed their fertility. Now
they can't even get remarried.
They can't get remarried, or they can't get one more child. So that is a tough situation.
So I want to focus on 4 important contraceptions which are used in India. So first thing I want to talk about is the contraceptive pill. According to the sexual revolution, it says that the pill actually changed the landscape of the marital act between a husband and wife. The promiscuity increased, the sexually transmitted diseases increased once the pills were introduced into for mass use. So what can happen when people use pills in their marital life, doctor?
The problem is the oral contraceptive pills. It is actually predominant content of an oral contraceptive pill is progesterone. Progesterone. The estrogen content of a combined oral contraceptive pill, it causes a lot of complications.
Okay.
Because it can cause blood clot. So the blood clot can happen in an artery or it can happen in a vein. So this is a major complication associated with the estrogen. So what is happening is that they are decreasing the amount of estrogen in the oral contraceptive pill and they are increasing the dose of progesterone.
Okay.
The problem with the progesterone is that progesterone is the hormone of pregnancy.
Okay.
So all those symptoms a pregnant girl or a pregnant lady will have, all those symptoms will appear in a girl who is having this tablet.
Okay.
So they will be having tiredness, they will be having bloated feel, they may be having a bit of nausea, headache, abdominal distension, abdominal pain, muscle pain, and all those progesterone related complaints will be there with this progesterone because the high dose of progesterone, it will cause all those complaints in a female. So once this girl is continuously taking this tablet, what will happen is that she is feeling tired and this husband is not bothered about what is happening to this female. So this can cause, because this progesterone will cause a bit of lability, emotional lability. So more irritabilities in between the relationships and all those problems happen in this life, and the husband is not bothered whether it is fertile day or infertile day.
He just wants to have
pleasure.
sex. Yeah.
He just wants pleasure. So even the female is feeling like I'm just considered as a object for pleasure.
So when the contraceptive pill is taken, the woman does not ovulate.
Yeah.
Because she's already showing symptoms of pregnancy, so the body tends...
So what happens is that the estrogen, high dose of estrogen and progesterone, it will cause feedback inhibition to the ovulation causing hormones.
Okay.
Ovulation is caused by the release of FSH and LH hormones. So this estrogen and progesterone will go and block it. But what happens is that the continuous exposure of this estrogen and progesterone, it will cause breakthrough ovulation. So body will learn it. My body is continuously producing estrogen and progesterone. So what will happen? Pituitary gland will give another spurt.
Okay.
So 32% of the girls will have breakthrough ovulation.
Meaning?
Breakthrough. So it is breaking up. It should not happen actually.
Okay.
But still it is happening.
Okay. In spite of the pill?
In spite of the pill, ovulation is happening.
Okay. So then what happened?
32% of the girls can have breakthrough ovulation.
So which means she can conceive?
So the problem is this progesterone. Progesterone has got very potent action on the uterine endometrium.
Okay.
So the uterine endometrium is made very thin and it is hostile for implantation. So what will happen? Even if there is a pregnancy, it will not get implanted inside the uterus and it will go off. So in a way, most of the contraceptives are also abortifacients.
And you actually touched upon a very important point where you said that the husband does not even know what the woman is going through because she's taking this pill, and the feminist movements of today, they somehow support this contraceptive pill as a sexual liberation, women's right, and it's so counterintuitive, no, doctor?
I feel a bit sad about how these ladies undergo the ordeal, how these ladies undergo, because this oral contraceptive pill, it doesn't, even when I give this tablet for a girl who is having irregular bleeding, I tell them the exact same tablet which is used as a contraceptive I am giving for a girl for her irregular bleeding or continuous bleeding or spotting continuously. So I give them, but I will explain them. When you take this tablet, you have all these side effects. And if it is a very busy OPD, I'll tell them maybe you will be having, if I don't explain all those things, if that girl is taking that tablet for the first time, many of them will come back and ask us, doctor, that tablet was terrible. I had please don't give it again.
Wow.
Please don't give it again. Because I agree the bleeding stopped, but I didn't feel it good. People will come and tell you. So the people who promote contraceptives and all those things,
they never talk about this.
They will never talk about how this girl is going through, because their primary motive is to prevent a pregnancy at any cost. They just want to prevent a pregnancy, and they don't want how this girl is feeling, how this husband is feeling, and how is their relationship going on.
Exactly. The relationship gets so much affected. In fact, I was telling someone that contraceptive pills actually contribute to the one of the second most reason for divorce in European countries, the Western countries.
Maybe I can understand it because the natural communication between a husband and wife, I don't think it will be there going on between a contracepting couple, because there is no need for it, because
they are getting what they want through the sexual pleasure,
and they don't bother about what is the feeling of the other person. I don't know.
Very true.
Because I don't have a personal experience of using a contraceptive, but I can tell from my patients who use for various other reasons, the contraceptives, when they use for other reasons, even then they are having bleeding and all those problems, but still they don't like to use this tablet.
Wow.
So it means this is not something that gives a comfortable feeling for a female, but they are ready to undergo through that all those discomfort and all those things, because they are having an objective like you. I don't want one more baby. I don't want one more baby at this point of time, or maybe I don't want one more child. So I feel like many couples consider children as a big burden.
Yeah.
So I have a difference of opinion, and I consider children as a blessing.
Yeah.
So I don't know.
Yeah. So moving on to the next one, doctor, the condoms. So condoms is, the prevalently used condom is mainly on the male.
Yeah.
Right. So what actually happens, because one question people ask me to ask you is, like, when the sperm does not enter the woman's body in when a condom is used, does the biological reactions which are supposed to happen after the sexual intimacy is not happening when a couple is using condom, right?
Yeah.
So does it have any significance?
The significance of I'm not that much into it, because I don't know. Naturally, when this semen is getting deposited at the cervix, and it has got its own hormones, and oxytocin release will happen.
Sure.
Oxytocin release. Oxytocin is the hormone of intimacy between
association.
Intimacy, the hormone of intimacy between the husband and wife. So if that semen deposition at cervix, if it is not happening, what will be the level?
Exactly.
I don't know. I haven't checked into the evidence behind that one.
Yeah.
But the use of condoms, it has got its own problems. I can explain.
Yeah.
First one is again, this condom is a barrier contraceptive. It can cause allergic response in some couples. It can cause allergic response. There are latex condoms and polyurethane condoms. Especially with latex condoms, some girls will develop allergic response, and some girls will develop something called non-specific urethritis. Urethra means the tube coming from the urinary bladder towards the outside, that urethra. There can be some kind of allergic response towards the urethra, and this girl can get some kind of lower abdominal pains and all those things. The second thing is related to the unexpected happenings with a condom, slippage, breakage, and all those things. When I use condoms for doing a transvaginal scan, even then, many times it will break off. So when a couple is using it during their marital act, definitely there can be chances of breakage, there can be chances of slippage, and some may not be using it properly. Slippage, breakage, and improper usage. These are the three causes related to the failure for
contraception.
Condom failure. Condom failure.
Yeah.
And the estimated failure of condoms is something around 15%.
Okay.
Failure in the sense, even those couples who use it regularly, 15% of them will conceive. And it is going to cause an unexpected pregnancy and all those problems. Then we'll have to counsel them. It is not unexpected, but it is the time of the Lord. We'll have to explain them with all our thing.
So some couples, based on my experience talking to young couples, they actually have a problem with the contraceptive pill, but somehow, those couples are okay with, the condom usage because it does not create any hormonal changes either in the woman's body or in the man's body. So other than the moral argument, what else, other than the irritations that you have spoken and the failure you have spoken, the moral argument, is there anything else which has a kind of side effect to the usage of a condom?
I think these are the main three ones.
Okay.
About the failures and about the irritations and all those problems and the moral side. What else? I can't say anything more.
And what about the pleasure that they derive out of the marital act? Does it come down when the condom is used? Because a lot of men complain that their spouses force them to use contraception, and they don't like to use it because the sexual pleasure actually comes down when the condom is used. Do you have any opinion?
I can't add to it.
Okay.
I don't know, because the thing is like when they come to a infertility OPD or gynec OPD, many of them may not be sharing to us about the pleasure aspect of their marital act. But for this copper teas and oral contraceptive pills, they will be complaining the side effects what they are having. They will come and tell us. Even with oral this barrier contraceptives or condoms, many of them will come. They are having irritable discharge or many things. Some of them will come and ask us. So, but this pleasure side.
Why I asked you that question, doctor? One of the research that happened in Germany, they say that the sexual pleasure and the emotional affection between the husband and wife, which is shared during the marital act, is drastically brought down
by the use of
condoms. So, which is why I just wanted to your comment on that.
I am not aware of that.
So, quickly moving on to the last one. So, this is the unique case where most of the Catholics don't even consider it to be a contraceptive method, which is the withdrawal method. So, before I tell anything about that, could you explain what happens or what is withdrawal method for the benefit of the audience?
Withdrawal method is actually when a man is reaching near orgasm. He is withdrawing his penis and the ejaculation is happening outside the female genital tract. That is called withdrawal method. Catholic teaching is against withdrawal method because it is said a marital act, it should be complete. It should be complete. Complete means the ejaculation should happen in the female genital tract or the ejaculate should fall on the at the cervix. So withdrawal method is not a natural family planning method, and it cannot be considered as a natural family planning, or it is not accepted by Catholic Church. So what from the initial thing what I have told, nothing can be done before, during or after marital act. So here something is happening during marital act. During marital act. They are not having the ejaculation at the female genital tract. So it is against Catholic teaching, no doubt.
Another important aspect, doctor, I got a lot of questions, in regard to the withdrawal method. So the orgasm, cycle for man and women are very different. So, women reach orgasm at a very longer period, and men reach very fast. So when they use the withdrawal method, most of the time the men have the pleasure of reaching climax, but the women don't have. So they actually feel used when the withdrawal method is used.
Yeah, that word you used, they are getting used.
Yeah,
that is there with every contraceptive.
Sure.
Every contraceptive, the woman or the partner is being used as an object for pleasure. So I don't know how these people still use it.
In fact, a lot of people, got offended when I said this is a fact. It is not something I'm making up. This is a fact, biological fact. So how would you, kind of convince a Catholic couple to not use this withdrawal method, because it doesn't have any chemical, any physical barrier. It seems so natural because nothing is coming in between the marital act. So what would you say, doctor?
No, when I take the pre-marriage class, I tell them you can choose fertile days, less fertile days for serious reasons, or you have just reasons, serious reasons to space a pregnancy. You can choose a less fertile day for marital act. There is no problem. But even then, when you're choosing the less fertile days, even then, what is there in my mind is that, Lord, if you want to give me a baby in this marital act, I am ready to receive. That is called openness to life. Because that is the biggest blessing that Lord can give me. To make me a father of one more child. That is the biggest blessing that Lord can give me. So many people don't realize it. That is what I am sad. Because people don't realize how having one more child is a blessing.
Yeah.
I always tell my patients, if you conceive again, you can come happily to me. Yesterday I did a 4th cesarean. I haven't sterilized. So many couples will come and ask me, doctor, this is 3rd cesarean or this is 2nd cesarean. Won't you do sterilization? I will tell them I won't do it. Because if God wants to give one more child for you, if God wants to give you one more child, and if you go and sterilize, God can't give one more. Because you are making God helpless before your freedom. You are making God helpless before your freedom. We are making God helpless. And that is the biggest element of pride. Pride goes before a fall. I think
I don't want to ask you anything about this. I think that statement seals it, that we make God helpless.
So and that is the same with every contraceptive.
That's
We
the
are
ultimate
making God helpless before our freedom. So when I take my pre-marriage classes, I tell them, you should not make God helpless. Let God work in our lives. And don't think like we'll do whatever we want and we want only His blessings. You walk according to His ways and you will see His blessings will follow you.
Yeah.
Wherever you go, His blessings will follow you. That is what I have experienced in my life. When I took up gynecology as my specialization, it was not actually to fight against abortion. It was actually to fight against sterilization and contraception. Because people don't know. So after joining in this hospital, I have been doing 4th cesareans, 5th cesareans, 6th cesareans, and 7th cesareans. Last April, I did a case of 7th cesarean, and I have invited them to come to me for their 8th cesarean, if God bless them.
Yeah.
Because I'm so happy to help them. I'm so happy to help them because to help a couple to have one more child, it is something beautiful.
Yeah. It's so refreshing, doctor, to listen to a Catholic doctor, affirm the Catholic teaching. So far, I have not heard anybody speak so clearly about this, in a very affirming way. So thank you for doing it. You want to quickly tell about the reversal operation?
There is something called tubal reversal surgery.
Sure.
Tubal reversal. So I told you in Kerala it is around 60% of the couples have got themselves sterilized, and majority of them, 98% of them, it is female sterilization or tubectomy. Of that, the studies from America, it says 14% to 40% of the couples want one more child. Of those sterilized couples, 14 to 40% want one more child. But they don't know how to do and they may not afford it. They can't go for tubal reversal surgery. In the Thrissur, when we did one study, the number of ladies who wanted one more child, the post-sterilization regret, the percentage was 32. And it was documented in a thesis and it was presented at Calicut University. 32% of the ladies wanted one more child. Tubal reversal surgery. So the option of reversing sterilization or the cut part of the tube, we will join it back and we will make them fertile again. That option is there. It is a microsurgical procedure and it will last around 1.5 to 2 hours. It can be done laparoscopically or it can be done through a small incision over the abdomen. It is not a big incision like a cesarean wound. Cesarean wound is around 14 centimeters. But a mini laparotomy or a small incision, it will be around 4 centimeters. We'll go inside, we'll pick the tube up, we'll freshen the blocked part of the tube, we'll open it out, we'll open the other side which is blocked, and we will put a small tube inside so that we will be able to do that micro. So yeah, when we do this tubal anastomosis, we rejoin the tubes and we will ensure the continuity of the tube, and this the fimbria or the end part of the tube is connected back to the isthmus or the part that is joining with the uterus.
Okay.
So that integrity is restored. Reversal of sterilization it is called, or tubal recanalization surgery. Being a microsurgical procedure, it is a bit costly, but there are places where we do it at a very much subsidized rate or a lower cost, so that more people can afford to it. We have been doing this surgery here for the last 7 years, and we have done more than 400 cases of tubal recanalization, and more than 200 couples have conceived.
Wow.
So the success rate of tubal recanalization is something around 60%. And it depends on the length of the tube that is restored. The original length of the fallopian tube is 10 centimeters. So usually the middle part, 2 or 3 centimeters, is usually cut off. Some doctors, to make sure their technique is perfect, they will cut off the tube. Some of them will do like that. They will do something called fimbriectomy. So the second half, or the part which is having that fimbria, that part is cut off. So in such cases, the chance of reversal is, the success of reversal is very less. But if you are able to join back from end to end anastomosis, then the success rate is very good. The second part is about the age. If the age is less than 38 or maybe less than 40 years, the success rate is good. But if it is more than 40 years, the success rate is going to be less. So usually we do this procedure till 40 years. So we have had couples who have done recanalization after 2 cesareans, and 2 of them or 3 of them has given birth to 3 more kids.
Wow.
So that is a very nice experience.
Yeah.
Giving birth to 3 more kids after sterilization,
Yeah.
and they are already having 2 more, total 5 kids. So recanalization surgery or tubal reversal surgery. So there is this option. Many of them don't know about the tubal reversal. Many of them don't know about the complication of sterilization. Many of them are not even aware about post-sterilization regret. Many of them don't know about empty nest syndrome. Empty nest, after both of these kids starts going to school, the husband and wife is feeling like empty. So this empty nest syndrome is there. Sometimes the partner can have an illness or problems. There can be divorce or all those things. Partner may die, second marriage can happen, remarriage can happen, illness for the children. I have had couples who have lost all 3 kids in accident, and they have come to me for recanalization.
Wow.
All these experiences I have had. Even once a couple came to me, they had sterilization. This child, this 1.5-year-old child, that child was there with his father, with his dad. His dad was reading newspaper, and he was having coffee in a glass cup, and his son had he just pushed that glass, and somehow it fell down and it got cut through the neck, and he died. Such a terrible experience for that father. They came here for recanalization, and they conceived, and they got 1 more child. So we don't know what is going to happen next. We don't know. When people take a decision about sterilization, I feel sad, because they don't know what is going to happen next. I have had couples who have come to me with their elder child is having attention deficit hyperactivity disorder, ADHD. So they thought they will have 2 kids, give them good education. But when they put that child into school, then only they realized their child is having attention deficit. That child is not going to reach according to their expectations. After 4 years of schooling, they realized it is going to be tough. So we don't know what is going to happen next. And government may be telling like small families are happy families, but what we see in Kerala, it is not happy families, but it is lonely families. It is not population explosion, but it is the explosion of loneliness. That is what we see in the families in Kerala. So contraception and sterilization, though it is very common, I would like to tell the young couples or the youth who are hearing me, I would like to tell them, beware, be cautious, realize, look to the evidence, what is the truth, and you can believe Catholic Church if it says something. That is the truth. That is the truth. If somebody is going and hitting on that rock, what will happen?
Yeah.
They will break their legs, that's all. Catholic Church is a rock. If you go and build your house on that, your house is to stay there.
After listening to you, Doctor, I just feel that you're not getting the due credit. I think, you should be called to speak in so many Catholic dioceses which are not giving importance to this main, aspect of gift of life in a marital sacrament, right?
I don't know, because I get a lot of speaking commitments, but I am not able to be free because my professional commitment is there a bit. My family needs my time. So
I just wish that people, more people like you would speak about the truth on Catholic teaching. So thank you so much for taking the time, Doctor.
Thank you.
Thank you so much.